Aneurysm. An aneurysm is a bulge or weakening in the wall of a blood vessel, typically an artery, that can lead to a potentially life-threatening condition if it ruptures. Aneurysms can occur in any blood vessel in the body, but they are most commonly found in the brain, aorta, and peripheral arteries. The main cause of an aneurysm is weakening or damage to the wall of a blood vessel, which causes it to bulge or balloon out. This weakening can be caused by several factors, including high blood pressure, puts stress on the walls of blood vessels, which can cause them to weaken and develop an aneurysm. Atherosclerosis is a condition where plaque builds up in the arteries, causing them to become narrow and less flexible. This can lead to the formation of an aneurysm. Family history. Aneurysms can be inherited, so if a close family member has had an aneurysm, you may be at increased risk of developing one. Smoking. Smoking damages blood vessels and can increase the risk of developing an aneurysm. Trauma. Trauma to a blood vessel can cause it to weaken and form an aneurysm. Infection. In rare cases, an infection in the wall of a blood vessel can cause it to weaken and form an aneurysm. It's worth noting that some aneurysms may have no known cause and may occur spontaneously. What are the symptoms of an aneurysm? The symptoms of an aneurysm can vary depending on its size, location, and the organs or tissues that it affects. However, some of the common symptoms of aneurysms include 1. Pain. Aneurysms that occur near the surface of the body may cause pain or tenderness in the affected area. 2. Headaches. Aneurysms in the brain may cause severe headaches, nausea, and vomiting. 3. Vision problems. Aneurysms that affect the blood vessels in the eye can cause vision problems, such as double vision or loss of vision in one eye. 4. Numbness or weakness. Aneurysms in the brain or spinal cord can cause numbness or weakness in one side of the body or the face. 5. Speech difficulties. Aneurysms in the brain can cause difficulty speaking or understanding language. 6. Pulsing sensation. Aneurysms that occur near the surface of the body may cause a pulsing sensation that can be felt by touch. 7. Low blood pressure. A ruptured aneurysm can cause a sudden drop in blood pressure, which can lead to dizziness or fainting. In some cases, aneurysms may not cause any symptoms at all and may only be detected during routine medical exams or imaging tests. If you experience any of these symptoms, especially severe headaches or sudden changes in vision, seek immediate medical attention as it could be a medical emergency. Is there a way to diagnose aneurysms? Aneurysms can be diagnosed through various medical tests and imaging procedures. Some of the common methods used to diagnose aneurysms include imaging tests, such as CT scans, MRI scans, and angiograms are commonly used to detect the presence of aneurysms, determine their size and location. CT scans and MRI scans use powerful magnets and radio waves to create detailed images of the body, while angiograms use a special dye injected into the bloodstream to highlight blood vessels on X-rays. Ultrasound is a non-invasive imaging test that uses sound waves to create images of the body. It can be used to detect aneurysms in the abdomen, such as abdominal aortic aneurysms. Blood tests can help detect if there is bleeding caused by a ruptured aneurysm or if there are any underlying medical conditions that may be contributing to the development of an aneurysm. If an aneurysm is suspected, further testing may be required to confirm the diagnosis and determine the best course of treatment. Can aneurysm be cured? In most cases, an aneurysm cannot be cured, but it can be effectively managed and treated to prevent complications. The treatment options depend on various factors such as the size, location, and type of aneurysm, which is 1. Unruptured aneurysm. Treatment for an unruptured aneurysm may involve close monitoring to detect any changes in size or symptoms. Depending on the size and location of the aneurysm, your doctor may recommend regular imaging tests and lifestyle changes, such as quitting smoking or managing high blood pressure. 2. Ruptured aneurysm. Treatment for a ruptured aneurysm typically involves emergency medical care to stop the bleeding and prevent further complications. This may include surgery or endovascular repair, which involves using a catheter to insert a metal coil or other device to block the aneurysm and prevent bleeding. 3. Management of complications. If an aneurysm causes complications such as blood clots or strokes, your doctor may recommend medication or surgery to manage these issues. While an aneurysm cannot be cured, prompt and appropriate treatment can significantly reduce the risk of complications and improve outcomes. Seek medical attention if you experience any symptoms or risk factors for aneurysm to receive appropriate diagnosis and treatment. What to do or avoid if you have aneurysm. If you have an aneurysm, here are some things you can do to manage your condition and reduce the risk of complications. Seek medical attention. If you have an aneurysm or are at risk of developing one, it's important to work closely with your doctor to develop a plan for monitoring and treating the aneurysm. This may include regular imaging tests to monitor changes in the size or location of the aneurysm, lifestyle changes to manage risk factors such as high blood pressure, and medications to prevent complications. Manage risk factors. Certain factors such as smoking, high blood pressure, and high cholesterol can increase the risk of aneurysm or contribute to the growth and rupture of an existing aneurysm. Managing these risk factors by making lifestyle changes and taking medications as prescribed can reduce the risk of complications. Avoid strenuous activities. Depending on the size and location of the aneurysm, your doctor may recommend avoiding strenuous activities that could increase blood pressure and stress on the blood vessels. Avoid alcohol and drugs. Alcohol and certain drugs can increase blood pressure and stress on the blood vessels, which can increase the risk of complications for people with aneurysm. Follow the treatment plan. If you have an aneurysm, it's important to follow the treatment plan recommended by your doctor. This may involve lifestyle changes, medications, or surgical procedures to manage the aneurysm and prevent complications. Work closely with your doctor and follow their recommendations to manage aneurysm effectively and reduce the risk of complications.